if you personally or someone that cares about you notices something they're worried about, what kind of provider that should they reach out to? Is there someone that specializes in dementia care? Should they reach out to their primary care provider? What do you suggest?
So I'll go with the best situation, right? Let's start with the best situation. Best situation meaning there's no access problem. Cool. Like I'm not living in rural America. Cool. I'm not living on without insurance. Cool. And I don't have a problem with healthcare. Like I'm not like, oh, healthcare sucks and I don't trust any doctor. Cool. So let's imagine the access is not an issue. My suggestion in these circumstances, I'll go to the person who has the highest number of hours and care for people with the same symptoms. So unfortunately, in these circumstances, I will go to a memory care specialist. Now, memory care specialists, it's a little bit broad. Don't make the assumption neurologists are memory care specialists. They are, from memory, they are as generalist as a primary care doctor. All right. So I will go to specialized memory care center that can be run by geriatricians or neurologists or behavioral neurologists or psychiatrists or geriatric psychiatrists. So that's what I call memory center. That's what I will go first if I have that symptoms. If you don't have that luxury, then you are becoming now into what I call suboptimal situation. For example, you have to go through your primary care doctor because you don't know other people. You don't want to ask Google about where that memory care. So if that is the circumstance, then go to your primary care doctor or take your loved one to their primary care doctor. And when you go there, grab the hands of the primary care doctor, say, I need to talk to you. Cool. About my family member. I am worried about their memory problem. Okay. And then if they are lucky, this is suboptimal. If that family is lucky and they have a primary care clinician who has time, who has demand to take care of this, then they can do what I call multi-phase way to manage these symptoms. So as simple as trying to figure out if these subjective symptom, is there any kind of objective symptom? So they can set up like a 5-minute, 10-minute brief cognitive assessment. And if they fail that, then they can move them to a much more comprehensive cognitive and dementia assessment. So that's really the best way. The last thing I would do is more futuristic. So I gave you the optimal where you have access issue. What about the future? And the future for me is where you can leverage information technology. And imagine if you are subscribed to services that will monitor the conversation that I have, you and I. You know, it's been recorded. There is some kind of like an avatar or an artificial intelligence, and look at the way I speak with you and you speak to me, and use that as a trigger for possible, something going on. And then based on that, it gives you more of a computer-based cognitive assessment that I can do, and do a caregiver reported symptom. And they can do that in you running algorithm and tell you, there's something going on. I already set up an appointment with you with your memory care doctor. Oh, can you imagine if that happened?
That sounds exciting. How close do you think we are to that reality?
Well, I mean, our group over here at least are leveraging information technology, machine learning in particular, but also data that you leave behind in your electronic health record. And some of our mentees, they are using the data that I talked to you, your voice, your video. And using that. So I think for early detection, it's there. I mean, technologically, we can do it. The problem is there demand for such thing right now? So technologically, I think we can do it yesterday. But the problem is not technological. The problem is social culture that will need to overcome.
So I think that is a great segue. So one question I have is if someone is concerned about themselves or a loved one, and maybe it's easier in some days not to think about it, is there a benefit to them for early detection, and a reason for them to seek out counsel from a professional sooner rather than later?
Yeah. So it all depending on what's benefit mean to you,
Mm-hmm.
right? So let's start with me. Like I'm not representative of anybody, so I'll just tell you with Malaz. So personalized for Malaz. So I am at high risk for developing dementia because my father has it. All right. And I have, and I'm 50. So in that way, I'm, 52 or so. So I'm still young. So the just by my age, my probability of having dementia is less than 1 per 10,000. Okay. So for me, if I start noticing memory problem, dementia is not going to be what I'm worried about, especially if my father developed dementia in late onset, like when he developed it in his 80s. So not when he was in his 50s. So early onset dementia is not in my family. If I start noticing memory problem, attention, I will be more worried that I'm having depression and I'm having anxiety and stress, and maybe I need to start working with my boss to take time off. All right, as a first attempt. But let's think about not Malaz. Let's think about my dad. So my dad, I failed in making diagnoses of my dad. So my dad was the same number of dementia patients who are unrecognized by the healthcare system. 50 to 80% of people with dementia, already with dementia, the primary care and the healthcare system, not just primary care, the entire healthcare system is not recognized them. And my dad was one of these pieces. So I'll tell you the story of why my dad not recognized dementia was terrible, because he has unrecognized dementia, even though I am his patient, I'm his son. He got sick during COVID, in the beginning of COVID, and he had heart failure. Because of COVID, maybe myocarditis or nothing. He went to the hospital. They worked up his heart failure. He had a lot of problem that require him to leave the hospital with 5 medication. All right. He went in with 0 medication. He got out 5 medication, which are beautifully evidence-based medication. One of them was a blood thinner. Cool. He is a doctor like me, but I don't think he had dementia, or I didn't even know that he had dementia. So he got out of the hospital and he was responsible for taking his own medication. One of them were very risky medication. 3 days later, he bled, he got delirious, and we had to bring him back to the hospital because he did not take his medication correctly. And that's how we recognize that he has dementia. So I can't tell you more than benefits, for that piece.
Yeah, I think that sometimes those kind of anecdotal stories that are very personal are the best way to illustrate the potential cost of something. And I'm so sorry that y'all had to navigate that. I'm sure at a really stressful time for everybody going in and out of the healthcare system.